Sometimes an addiction can be a coping mechanism for another behavioral disorder, and sometimes it can be part of the disorder. But Mount Regis is now offering a dual diagnosis specialty track to help patients not only recover from their addictions, but get help with their behavioral disorder as well. Heidi Taylor tells us more.
We've begun a specialty track in which people who come in with underlying mood disorders can participate. Oftentimes people think that if they treat their depression or anxiety or bipolar disorder first, their addiction will improve, and that's just not the case. The addiction is always treated as primary. And so for people, though, who have a secondary diagnosis, such as a mood disorder, anxiety and depression are really quite common, as is bipolar disorder. This is an opportunity for them to address both their addiction issues and their mood disorder issues at the same time. They'll receive education, they'll participate in groups and in specialty track groups where they can learn how to manage both their addiction and their mood disorder.
And why is it important to treat the addiction first?
Well, because if somebody's using alcohol, which is a depressant, their depression is not going to improve. It's going to get worse. And also just the destabilizing effects of drugs and alcohol on mood.
So if somebody has an addiction and they come in here and they might not know they have an underlying issue, can you guys help them figure that out?
Yes, sometimes after we that requires a bit of time to see how the person does as they're here and as they're off their drug of choice. And sometimes people will stabilize. Oftentimes it takes up to 6 months to really see, but oftentimes people have been diagnosed with a mood disorder prior to coming here, and those are the people that we want to identify and get linked with this specialty track.
And how does this specialty track work?
Well, they will see our psychiatrist as always, but they'll have more education with nursing staff and medical staff on managing medications. They'll have groups on things that they can do behaviorally to make changes to support recovery from depression. There are a lot of things people can do that help, like daily exercise is one of the best things that somebody can do to alleviate anxiety and depression. Having regular meals, having a life structure, learning how to manage conflict and overwhelming feelings like anger. Those are things that will be addressed in groups.
So really just simple lifestyle changes that can really make a huge difference, and it's not really about medicating or things like that. It's really just about the lifestyle.
Absolutely. Those things can make a huge difference. And really the best course of treatment is a strong recovery program, attending AA or NA, working with a sponsor, having a psychiatrist who will manage medications, and doing then outpatient psychotherapy, outpatient counseling. And all of that together really helps people recover.
Yeah, because I can imagine that some people kind of have turned to whatever they're addicted to because of these behavioral problems.
Sometimes that is the case, right? They self-medicate.
This is a good way to work through those in a safe group environment with people who are going through the same thing.
Absolutely. So they don't feel so alone and isolated.
And what's the first step to getting help on this track?
Well, just reaching out, letting somebody know that you need help, making a call to Mount Regis Center just to get information. That's absolutely fine. We're happy to talk with people anytime about what their needs are.
And speaking of people's needs, that's really what the focus is here. It's not, a certain amount of days based on a special track. It's really based on the person.
Right. Each patient here has an individualized service plan that's designed specifically for them and that will meet their specific needs.
So if you are struggling with an addiction out there, it's important to take that first step. Even though it might be scary, you guys are nice and you're here to help.
Thank you. Yes. It is a scary first step, and we try to make it as painless as possible for people and to help them feel comfortable and to give them a sense of hope, because it really is, when people come in, oftentimes they're quite hopeless and desperate. And it's really wonderful to see people start to engage and realize that they're not alone and that there is hope in recovery.
And Mount Regis Center does offer hope, and they have so many different tracks that are specific to individuals. For more information, you can call 540-389-4761, and calling that number really is the first step. And you can also go online to mountregis.com.